Hello, I'm Dr. Vaishaka KV. I'm consultant neurologist at GG Hospital, Trivandrum. Today we will briefly see about what is peripheral neuropathy, what are the causes of it, what are the symptoms of a peripheral neuropathy, why do we need to diagnose a neuropathy and treat it at the right time, and how do we take care of such patients. So peripheral neuropathy is a specific term that describes a disease which predominantly affects the distal peripheral nerves that give supply to our distal lower limbs as well as upper limb. These nerves can be usually affected by a variety of toxic, inflammatory, hereditary, infectious or para-infectious factors that can impair their health and function, leading to a clinical disorder called as peripheral neuropathy. Now, the symptoms that a peripheral neuropathy causes depends on the type of nerve fiber that it affects. So there are three types of nerve fibers: the motor fibers which give muscle power, the sensory fibers that carry the sensation, and the autonomic fibers which are entitled to maintain certain vital functions, including the heart rate, the blood pressure variation, and the bladder and bowel functions. The most common sensory symptom in neuropathy is sensory loss and dulling. The neuropathic pain is a pain that is caused by the damage of the nerve, and this usually manifests with a burning, tingling, sharp, or stabbing pain. People can have pain all the time, or the pain can come and go, and usually the neuropathic pains worsen during the night time. The patients can also have hyperalgesia, in which even a light touch is perceived as pain. They have a cotton wool sensation, in which they are unable to feel that they are gripping onto the chapel, or the ground feels so soft that they don't get balance on those surfaces, resulting in gait ataxia or loss of balance. Now, the motor symptom, the most common symptom that we see is the weakness. This can manifest as clumsiness, difficulty in gripping onto the chapels. When the upper limbs are affected in severe neuropathy, they can have difficulty in doing the simple tasks such as buttoning the shirt, opening a glass, opening the cork of a bottle, or using a key and lock. Now, the autonomic system, when it is affected, it causes abnormalities with sweating, abnormalities with taste, abnormalities with urinary and bowel function, and they can also result in erectile dysfunction, which is more commonly seen in patients who have their autonomic symptoms affected early in the disease. So polyneuropathy is caused by a wide variety of causes which can be classified into many headings, but for all practical purposes, the most common cause of neuropathy in our setting is the diabetes. The other causes include the chronic kidney disease, certain infections like HIV, autoimmune disorders in which our own immunity attacks the peripheral nerves. Then there are certain vasculitis. Then there are certain malignancies which present with peripheral neuropathy either as a result of nerve infiltration or as a paraneoplastic manifestations. Then there are a group of neuropathies called as hereditary neuropathy, which is seen in a younger population like Charcot-Marie-Tooth disease. And even if we investigate the peripheral neuropathy patients extensively, around 46 to 50% of them, we may not be able to identify a definite cause. The characterization of a peripheral neuropathy predominantly depends upon the careful history taking, during which a clinician evaluates the evolution of your symptoms and a detailed neurological examination so as to decide which all fibers are involved. And finally, this will be followed by a nerve conduction study and electromyography to assess the health and function of the nerves. The most common cause of neuropathy among our population is diabetes. Among people with diabetes, certain risk factors like associated cardiovascular risk, associated morbid obesity, or increased BMI more than 24, smoking, high blood pressure, increased triglyceride levels, etc., predispose to the development of a neuropathy. This neuropathy results in neurological disability due to sensory loss, and this results in the foot ulcers. And approximately 15 to 20% of the patients have painful neuropathy, which limits their daily functionality. Why should we identify the diabetic neuropathy and get the treatment at the earliest? So, as we lose the ability to sense pain, hot or cold sensation, the risk of injuring our feet increases. So, many of the injuries that will normally cause pain, like stepping on a stone or development of an ingrown toenail, they do not necessarily cause pain if we have neuropathy. Unless we inspect our feet on a daily basis, these small injuries may be missed and they can develop into a large ulcer. And one of the most serious complications of foot ulcer is the need for amputation at a later stage. So how do we treat these neuropathies? The first and foremost thing in treatment of this diabetic neuropathy is the optimal control of blood sugars. in consultation with either an endocrinologist or a physician. The second step is, of course, a lifestyle and regular exercise pattern. And what we obviously ignore is we forget to take care of our feet. So, how do we take care of our feet? So, people with neuropathy, as we discussed, do not always feel pain when there is a wound or injury in the foot. As a result, daily foot care is necessary to monitor for the changes in the skin, that is, whether there is any crack or any wounds which can increase the risk of infection. The ADA recommends that people with diabetes should have a detailed foot checkup once in a year and a visual examination of the feet done by a clinician at least 3 to 4 months, once in 3 to 4 months. And control of pain caused by this neuropathy is achieved through a host of various medications like tricyclic antidepressants, SNRIs or serotonin norepinephrine reuptake inhibitors like duloxetine and venlafaxine, and gabapentinoid drugs like pregabalin and gabapentin. There are a host of topical agents available for those who do not tolerate these oral agents, which are less efficacious as compared to the oral medications. The point is, if the pain is not controlled by one medication, we should have adequate patience in trying other medications which may be suiting you. So the take home messages from the talk are: peripheral neuropathy is a very common disease. There are a host of causes that causes peripheral neuropathy, ranging from diabetes to malignancies or cancers. The most common cause of peripheral neuropathy in our setting is diabetic neuropathy. The most important aspect of taking care of diabetic neuropathy in an adult patient is to ensure that the limb health is preserved during the lifetime of the individual and they do not go into amputation, losing the limb, resulting in permanent disability. Thank you.